Okay, so I hinted at various things this morning, and as you can imagine, there's a lot of work to be done in this area. There is still much we don't understand, and still lots to do in terms of improving treatments as well. So what I'll do is start by talking about what we are doing in terms of research studies, things that you can be aware of, things you might be involved with. Two particular key things that we're looking to do at the moment to underpin forthcoming research. And obviously other things we hope to do in the future. So we have a number of studies based in the UAE at the moment. One of these is called the Chronic Rhinosinusitis Epidemiology Study, known as CRES for short. This is a national study. Unfortunately, last year we were able to get this study elevated to something called the National Portfolio, which is basically a system where studies are recognised nationally and supported by research and development departments at individual hospitals. We're now recruiting over about 30 sites nationally, and we're almost about to close this study. Basically, this has been a questionnaire-based anonymous study, so any patients with a diagnosis of any form of chronic rhinosinusitis are asked to fill out this questionnaire and post it back to us. It gives information about socioeconomic status, individual risk factors such as smoking and diet, environmental risk factors in their individual locality, other medical conditions that they may be affected by, and also takes a symptom score and a quality of life score. And essentially what we're going to start doing in the next few months is simulating all that data and analysing it and working out whether particular localities, particular groups of people are more at risk or more adversely affected by this problem. This is sort of information that will help us underpin forthcoming research applications, so it's really going to be crucial work. That hasn't been done in the UK before, it actually hasn't been done quite in sort of detail in other countries either, so it's going to be really useful information for us to extrapolate. The next study which we're currently running is something called the feasibility study for clarithromycin in chronic sinusitis. I mentioned earlier that patients who have chronic sinusitis where polyps don't form, the current European guidelines are that we give these patients 3 months of antibiotics. Unfortunately, that sort of recommendation is based on only 2 trials, or I should say 2 randomised trials. So in scientific terms, for a trial to be accepted in the medical community as robust, a trial has to compare drug A with a placebo. Does the drug A work more effectively than just giving a placebo in terms of improving symptoms, but what your outcome measure is on an improvement outcome measure. So in order to prove that antibiotics are the right thing to do for these patients, we need some more robust data about that. We have put in a funding application which unfortunately was previously rejected. So what we want to do is actually kind of demonstrate that the feasibility of actually recruiting patients to this kind of trial, that we're going to be able to do it and we're going to go forward with a formal drug trial. So in this situation, what we're asking to do is people who would go through the normal treatment pathway to actually come in for some additional tests at the beginning and end of the treatment, and then get followed up 3 months after treatment with some additional questionnaires. So actually, for the patient, it's not too dissimilar to what they would normally go through in terms of the treatment in the clinic. So currently, we've got sort of about 6 sites involved, which are also coming online. As I mentioned already, this study we applied for a grant for, I think it was close to £1 million to fund this trial. And you see the kind of money involved in running a drug trial is quite expensive. Unfortunately, it didn't get past the first hurdle because the prioritisation board said that it wasn't an important priority for the NHS. And you can hear it lies one of the problems that I face, and I'll come back to it on subsequent slides. We're hoping to resubmit this application next year, and this feasibility study will help to inform this application. So we're encouraging, obviously, anyone in the vicinity of those sites that is this particular condition. Obviously, we'd like to recruit patients to this study because obviously the more we get through, the more information we have. The next study that we've just started a couple of months ago is something called the Socioeconomic Impact of Chronic Sinusitis, known as the SOCCA study. Again, one of the problems that we're trying to convince a funding panel to give out money is that is this a problem causing a burden on the NHS? Is it causing a burden to individual patients' pockets? So what we're going to be doing is another questionnaire-based study. I'm actually going to be asking patients to do questionnaires at the time of recruitment and 6 months later, and really good collecting information about the money they spend on prescriptions, over-the-counter medications, visits to hospitals, visits to GP, any private medical care they may choose to have, and sort of alternative medical care they might choose to use. Any kind of impact it has on their family, perhaps the family member has to take time off work, take them to hospital, etc., etc. That sort of information is crucial for us to make a case that this condition is worth funding and treating. So that's currently just started, and we're just currently battling to get that recognised as a national study for the portfolio. And if that happens, it will get supported around the country. One of what you may be more interested in, for those of you without sinus problems, is something called the sodium citrate trial for non-conductive smell loss. This is for anybody who doesn't have a risk problem in the nose and sinuses causing their smell loss. So that's people perhaps post-viral olfactory loss, with post-traumatic olfactory loss, perhaps those with an unknown cause, which we've not identified a problem in the nose and sinuses. And this study is currently running at James Paget Hospital. Essentially what it involves is coming to the hospital for one visit, just for a morning or afternoon. You'll be randomised to either receive the active ingredient or a placebo, placebo is basic water, and we'll test your sense of smell before, then every 15 minutes after, 2 hours. Our initial preliminary results when we analysed the first half of the data suggested that patients who are hypoxic showed an improvement, but those results aren't statistically significant until we've completed the adequate number of patients. We're looking for a total number of 50 patients. We've currently got about 23 enrolled in the study, so we're looking for obviously a similar number again to get our target figure to actually say that this is an effective treatment. Now, what this may mean is that if we prove it's an effective treatment, is that this is something you could carry in your bag. So just before you're about to eat a meal, you could spray your nose, get half an hour of improvement in your sense of smell, or it disappears again. At least obviously this would be an improvement on not being able to enjoy the food at all. So we see this hopefully as a positive sign of something in the future. So I think one of the key things that I want to kind of engage people with, and what I definitely want to look for support from this centre membership is with one of the things that we have to now do as a checkpoint in trying to generate interest in our research area is something called priority setting. And there's this body called the James Alliance, which has now been incorporated into the National Institute of Health Research. Basically, that body is there as a sort of to oversee collaboration between patients, between doctors, and between any other stakeholders in the delivery of healthcare relevant to that particular individual condition, about setting priorities for research, perhaps also for treatment and also audit. And in order to do that, we need people like yourselves who are members of the patient support group to get involved with that prioritisation process. Now, one of the things that we've got to do is actually get some money in place to do that, and I'm hoping that there'll be some of our bodies, such as the specialty body into UK, that will invest the money in that. But that's work in progress. But if you are interested in getting actively involved in supporting research and development, we will be looking at people that will need to meet probably 2 or 3 times over the course of the year in a committee to discuss what they think are the key research priorities that we take forward, and then actually establish out with the National Institute of Health Research as things they will fund.
And this is something, one of the sort of future things that we're looking to do with Fifth Sense is actually sort of establish a Fifth Sense kind of research group, essentially, with members who are interested in sort of doing this on a regular basis.
So things that are up and coming, my colleague Claire Hopkins, who's an ENT surgeon and rhinologist at Guy's Hospital in London, has submitted earlier this year a study proposal for, again, somewhere in the region of about £1.6 million. So you see again the kind of money we have to apply for, and that's to compare surgery and steroids to steroids-alone for patients who have chronic sinusitis with polyps. Although you think it's sort of study that's been done already, it hasn't been done. Until we got that information, we can't sort of then go on and say whether or not minimal or maximal surgery is more beneficial, which is the next step. I mentioned the trial on clarithromycin. Another study that we're hoping to try and get up and running is just actually taking information that's already out there in the medical literature analysing it and looking to see what out of the current treatments available are the most cost effective. One of the things about sinusitis is that we don't fully understand the natural history of the condition. So when we do a study, ideally looking at following patients from the first inclination to the beginning of the problem through the point of losing contact with clinicians. And then specifically in relation to olfactory disorders, I'm hoping to set up some drug trials. We have been applying, I'm hoping to make an application later this year. But some of the things I'll talk about next are really key to feeding into that application. So what's the next step? One of the things that we don't have figures on for the UK are really the number of people that are affected. So obviously we know that you've all come today and we know the people that have become members are affected, but we want to know really how many people in the UK as a whole. And we have sort of ideas of information from other European countries and from the US. But in order for the NHS to sort of recognise this, we need to give them a number about how common this problem is. Now, about 20 years ago, the National Geographic basically sent out a survey and a scratchy sieve booklet to all their membership, and they had about 1.4 million replies. And obviously, the size of the US population is about 230 plus million, but it was amazing that nearly 50% of those replies contained some degree of human sensory impairment. So we want to replicate that information in the UK, and in order to get a proportional sample equivalent to the US size, we need to target about 500,000 people. And this will also be supported by a national PR campaign, allowing us to demonstrate the size of the problem. Now, we've already got hopefully some people engaged, including Shiverdown, interested in helping us with this. The Fragrance Foundation are hoping to engage with us on this. Last one to the medical companies. We need about probably about £60,000 to £80,000 in order to run this survey. So again, we need to generate that sort of money from sponsors. And this sort of information will just be crucial to sort of saying this is a big problem and recognising it